Hello, everybody. Thank you so much for coming today on this beautiful Nurses' Day in May at the flagship of all Iowa hospitals, the University of Iowa, in this lovely garden. We'll go ahead and get on with our exciting news on Nurses' Day. I want to introduce you to a colleague of mine. My name is Swisher, by the way. I'm the Government Affairs Director for SEIU in Iowa. And I want to introduce you to my colleague, Cathy Glasson. Cathy is the president of SEIU Local 199 and also the president of the SEIU National Nurse Alliance. So we have her here today speaking both to nurses in Iowa and nurses across the country for the historic information we have to share today. Cathy?
Thanks, Sarah. And I just want to welcome folks here, the nurses that are out here, which they're actually probably inside working, which nurses generally do, so we want to recognize them just behind us here in this great institution at the University of Iowa Hospitals and Clinics. And on that same note, I'd just like to recognize some of the special guests here with us from the University of Iowa. We have Ann Williamson, who is the Associate Vice President and Chief Nursing Officer here at the University of Iowa. We want to recognize her. And also Heidi Nobling, who is a Senior Assistant Director of Nursing and Hospital Administration here at the University of Iowa. We work very well and collectively here together to improve nurse working conditions as well as other hospital workers here at the University of Iowa. First of all, just a few little facts about the world of nursing in the state of Iowa. Nurses make up we're the largest group of healthcare professionals in Iowa, and SEIU just happens to be the largest union representing nurses in the state, and we're the largest healthcare union nationally. Governor Culver and Lieutenant Governor Judge convened a task force this February to assess the growing threat of a nursing crisis and wanted to work to develop strategies along with fellow nurses from across the state to prepare Iowa to care for our aging population. While registered nurses are dedicated to the well-being of their patients and the health of our state, quality nurses must be recruited and retained to meet the future needs. One of the greatest obstacles ensuring the nursing workforce has been the lack of competitive registered nurse wages in the state of Iowa. We currently rank 52nd in the nation behind Guam and Puerto Rico in average nurse wages. In his State of the Union address, Iowa's Governor Chet Culver established the task force goal, which was to find ways to ensure the nursing workforce meets patient demands, to increase wages to the national mean within 3 years while ensuring the highest quality of care. SEIU is proud to have played a critical role in both researching the problem and leading the charge for change. Members Sarah Swisher and Terry Murphy, both registered nurses, served on the Wages Subcommittee of this task force. Today, I am so proud to announce that because of our union's skills and tenacity and the wisdom and leadership of the Iowa General Assembly, we've taken the very first step to deliver increased wages to Iowa's nurses. Now I'd like to introduce to you Senator Mike Gronstal, the Iowa State Majority Leader, and Senator Bob Dvorsky, Chair of the State Appropriations Committee, to tell you a little bit more detail about this great news.
Join us together. We'll both come up here together, and I'll be pretty brief. This is Bob's world, both figuratively right here where we're standing, and also he is the chair of the Appropriations Committee in the Iowa Senate, so he's the guy that helps figure out ways to come up with money. And we are both pleased that we were able to provide this modest effort this year to deal with nursing salaries in the state of Iowa. And I'll let Bob fill you in on more details, but I want to thank all the nurses that aren't here, that are inside there working, for providing the great care they provide to thousands of Iowans every year. Thanks for everything you do. We hope in some small way what we've been able to do this year gives you some idea that we do value you and we are moving in the right direction. So take it away, Bob.
Thank you. First of all, happy Nurses Day to everyone here and all the other care providers here at University of Iowa Hospitals and Clinics. It is real exciting what we've been able to do working with SEIU and other stakeholders to an end of the session agreement with the hospitals to use appropriated Medicare provider increases to improve wages of hospital employees and bedside caregivers. So essentially we're trying to move forward with what the governor outlined a little while ago and in some small measure move forward to get those wages and salaries up. 52nd isn't somewhere we want to be, with nurses' salaries in the United States. And this is one step forward. I'm glad we're able to do that. And congratulations all nurses on Nurses Day.
We really appreciate your leadership. Thank you very much. And we have more leadership in the state legislature that's here with us today to celebrate during Nurse Week, and what a better way to do it than this announcement. Our next speaker, and speaker he is, of the Iowa State Legislature. He's a leader in healthcare issues. He's been a friend of SEIU as well as Senator Gronstal and Senator Dvorsky, and he's a friend of labor. Please welcome Speaker of the House, Pat Murphy.
I'll just be brief in my remarks. I'll just say this. This year, Democrats in the legislature very much wanted to increase access to health care. And we passed some bills that dealt with making sure that every child within the next 3 years would have access to health care. But one of the issues that's been overriding is the issue of wages. And as Senator Dvorsky mentioned, 52nd out of 54 U.S. states and territories is not where Iowa should be. There's no question that nurses care about one thing, and that's making sure that their patients get the best possible care they can. And we want to make sure that the state starts recognizing that care by making sure that they're paid adequately. So I think this is a very good first step. We addressed in the last 2 years the issue of teacher pay. Now we also need to address what we can do to increase the pay of nurses in this state so we become more competitive. Our young nurses that are graduating from our colleges and universities and community colleges can get the opportunity to receive the pay that they so dearly deserve, and that is making sure that their payment goes up. So with the agreement that we had with the Medicaid bill that reached, having it go into direct RN wages, I think is a first step, and hopefully the first step of many steps in trying to raise the pay and awareness of the professionalism of this profession in general, but also to give them what they deserve, which is a better paycheck and more of a voice in their healthcare decisions. And the best way we can do that is by increasing their pay and getting as many nurses as we can to stay here. So I thank you for SEIU for this opportunity today. And again, I better say it too because my wife is a nurse. Happy Nurses Day, especially to one in Dubuque, Iowa. Thank you.
So that concludes our press conference today. We will be around to take questions. Thank you.